Hi, everyone. Welcome. Hi, everyone. Welcome, welcome. Hospice Nurse Julie here. How's everyone doing? Happy almost Valentine's Day. Welcome to the Live at 5 that I have every Thursday at 5 p.m. Pacific Standard Time when I don't forget that I have it. Welcome. Come on in. How's everyone doing? I love that we have like a chat going even before I'm here. My head's a little cut off, isn't it? There we go. Welcome, everyone. Let me say hi to everyone. Hi, Matt. Hi, Zachary. Hi, Susan, Jennifer, Laura. It's my alarm going off, reminding me I have a YouTube. Sally, Steph. Hey, Steph. Hey, Julie. Hey, I think second Lori. I think we have two Loris. Catherine, Eileen, Shabby, Chicky, Lynn, Sherry, David, Maya, Nicole, another Susie. I think we have two Susies. Linda. Welcome, guys. Come on in. So happy you're here. This is a place where we all get together. You guys can ask me questions. It's also a community of people. A lot of the same people come back every week. Thank you so much for supporting me. Welcome, everybody on TikTok. I am on YouTube going live. You're welcome to listen to me here. But you won't be able to ask questions on TikTok, but you can ask questions on YouTube. Same name, Hospice Nurse Julie. It is raining like cats and dogs here in Los Angeles, California. And let me tell you, we don't see that often. So when we do, it's like everyone stays in, no one does anything, or at least that's what I do. And I grew up like on the East Coast where like it could like rain and sleet and ice and snow and like nothing shut down and we drove and everything. But then I moved here and I became a little softy. Hi, Kitty. Sneaks in quietly waving. Kitty, oh my God, that's so cute. Okay, first question. Shouldn't hospice nurses know an approximate time someone has left? We never get a straight answer. My father's nurse says, who knows? Now, here's the thing. No, I would say we don't totally know. I always say the further someone is from death, like if they're in the months category, which still isn't very long of a time, but for hospice nurses, it is. So if someone's in the months category, that's going to be a very gray area. We are definitely going to say, oh, it's really hard to know, probably months, maybe more, maybe less, because they're not showing true signs of like getting closer and closer to death. Specifically, if someone has like a chronic terminal illness like Parkinson's, dementia, Alzheimer's, congestive heart failure, COPD, those diseases can like last long periods of time, even though they're very debilitated, meaning like they're fully dependent, they need fed, they need changed, they can't speak, but they still could be far from death from hospice standards. So the only time I can really give like a good timeline is when someone is like maybe a month from death or a few weeks from death. They show it a little, there's a little more signs. And people with like dementia or Alzheimer's, that's really hard to it's really hard to do because they can live for a long time by eating like a little like few spoonfuls of jello and drinking some water. They can still live like that for a long time. So that's my long-winded no. Hospice nurses don't know. Of course, no one knows. The closer someone is to death, the easier it is for us to know. But if they are just sitting around kind of and it's just general, then no, we wouldn't know. But technically speaking, I always say if we don't know, that means they're usually in the months range. And if someone has those certain type of chronic terminal illnesses, it's even harder to prognosticate, I think is the word. I hope that helps. Can you describe the energy when people start the dying process? Um, the energy. The actively dying phase, I would say, is when most people become the most fearful because it looks like their loved one's suffering. They're fully unconscious, their mouth's hanging open, their eyes are open, but like no one's home. They have changes in breathing, changes in skin color. Sometimes they have that gurgling noise when they're getting close to death. And the energy can shift in the room because people start kind of freaking out. But the person usually looks pretty calm because they're fully unconscious and the body knows how to die and the body's taking care of itself. When someone takes their last breath, I do think the energy shifts in the room, but that's just my belief and like things that I think I feel, but it doesn't necessarily mean that's truly happening. But I feel like there's like a kind of like a stillness in the room when someone takes their last breath, like an expansion in the room, that kind of holds and then shuts down when they are gone. There's like a little bit of an emptiness there for a bit. Um, because the grief for me is removed because it's not my loved one. To me, it feels quite beautiful. Thank you, Megan. Hey, girl. I'm going to do my best to try to read the questions. If you see me looking down, that is why I'm looking down. I'm trying to read the question. Who determines how much pain meds nurses can give a patient? The doctor? The doctor, but we have a really good, strong working relationship with doctors. So, but yeah, technically, we can't prescribe meds or change meds. We have to ask the doctor. But you go by what the patient says. If they can't talk, you go by nonverbal cues. So that's the nurse and the doctor work together to figure that out. My grandma was actively dying with hospice nurses at the home. She lived for a week. Is that a typical time frame? I found peace being with her during the time your videos helped a lot. Thank you. And yes, a week is a normal time frame. It's a little longer, but a few days, a week. I feel like a week's a little longer than normal, but it's definitely normal-ish. Normal-ish. The longest I've seen someone in the actively dying phase is 3 weeks, which is not normal. But they still weren't suffering. It's just their body taking their time. Amy says, sent home on hospice today, 25 RPM, and keeps looking upper left. No real communication except the occasional grunt. He occasionally opens his eyes. Does this mean anything? Amy, I would say no, but I would really work with your hospice company. Don't just listen to me. They'd be able to evaluate if they thought he was having pain or not. I would say sometimes grunting could mean there's pain, but grunting can mean a lot of things. Our bodies do a lot of strange things at the end of life just because they're kind of shutting down. Generally speaking, I would, in your mind, if your mind starts racing, which would be very normal at this time, just listen to my voice and hear these words. Is he clean? Is he safe? Is he comfortable? So clean and safe, you probably got that. Is he clean? Is he safe? You're like, check, check. Is he comfortable? If you're not sure, that's when you want to call the hospice company and ask them, describe what's happening. But if you haven't seen my actively dying yet videos yet, Amy, I would look at those so you can see what actively dying looks like. So you don't confuse actively dying with someone being in pain. Because a lot of times people confuse actively dying with suffering. But generally speaking, if you don't know, ask your hospice team. Can you describe the process when dying patients see dead relatives and friends? This is a medical phenomenon called visioning. We are not sure. Oh, one second. Michelle says, why are there ads? Crazy. That is crazy. I don't know why there's ads. I didn't know there were. So it like stops the live and shows you an ad. I did not know that. Okay, so visioning is a medical phenomenon that happens in many, many patients on hospice. Usually happens 3 weeks to 4 weeks out, maybe like 2 to 4 weeks out, where they are usually fully alert and oriented and just start seeing dead relatives, dead loved ones, pets who have died. And they usually are very comforted by this. The loved ones usually bring them messages saying they're going to be okay or they're coming to get them soon and not to worry. We don't know why it happens, but it does happen a lot. And of course, the naysayers, which I am not here to say that anything spiritual is actually happening. I have no idea. It could be fully biological, but we don't know why it happens, but we do know why it doesn't happen. So it's not due to lack of oxygen in the brain, which many people think. Most people dying don't have lack of oxygen to the brain until the very, 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 very end. And that is not when they're visioning. They're visioning much earlier than that. They also are not on a lot of medications. And if they are, these medications have not been causing them to be confused. They're usually very clear when this is happening. There's a big difference between medical delirium or ICU psychosis or terminal agitation versus visioning. Visioning is a very clear thing that happens across all cultures, not just here in America. It happens, worldwide. And it's a medical phenomenon that we can't explain. My whole chapter 6 in my book is all about the medical phenomenon that we see. Can a hospice nurse give extra meds to make death faster? No. No, and they don't do that. The person is already dying. The person is dying, whether we give meds or not. The medications we give, there's a misconception that we're giving like heavy, heavy, heavy amounts of narcotics, which is not true. Now, someone may come onto hospice with an advanced disease where they've already been given a lot of narcotics, right? They're already on a lot of medications because they've been in a lot of pain. But most people come onto hospice with not that much pain medicine, maybe a little bit here and there. And even the amount we're giving, if people just think it's a lot because they're not used to people getting narcotics, but really the amounts we give are very, very small. And surprisingly enough, in order to give enough like narcotics to actually drive someone's respiratory drive down so much that they die, it actually takes a lot. People, because so many people like OD from narcotics abuse, that people don't think it's hard to do, but it actually is pretty hard to do. And we're not injecting into their veins, into their bloodstream, so it's very, very mild. But I think pain medications get a really bad rap. Because of the abuse of them, which no judgment, I understand, but no. So we're not giving enough to make someone have a respiratory arrest. It's called, to drive down their breathing so much they die. We are not doing that. It's actually been clinically proven that the morphine we give does not do that. The only thing it does is make them more comfortable. Does a pacemaker interfere with the dying process? No, that's a great question. Pacemakers don't, but some people have pacemakers and defibrillators. So pacemakers just work with the electricity already in the heart, helping it pace. Defibrillators will shock the heart out of a deadly rhythm. So some hearts will go into deadly rhythms a lot. So they get a defibrillator placed in their heart so they can get shocked out of those rhythms so they don't die. At the end of life, when we know they're dying anyway, a pacemaker will not interfere because once that heart stops, the electricity stops and then the pacemaker stops. So it won't keep someone alive or keep them, like it won't prolong life. But a defibrillator, if that heart goes into a irregular rhythm or a deadly rhythm, which sometimes they do at the end of life, the defibrillator will go off. So you would want to get the defibrillator shut off before you came on hospice. Sometimes on hospice, we can use a magnet. If they didn't get it shut off before they came on hospice, we can use a magnet, and that can help shut it off as well. Is it normal to feel agitated to see a loved one dying? How do I deal with it better next time? It's definitely normal to feel agitated when someone's dying because one, it's hard to communicate with them. It's super, super, super wildly uncomfortable. You can feel overwhelmed. And I think people handle overwhelm differently. I know when I feel overwhelmed, I can get agitated and irritated. Just ask Rich. He's not here right now. Rich knows that. So I think we also have expectations of how we're supposed to act, what we're supposed to say. We feel responsible to make them feel better, and all of that can make you feel agitated. So I would say next time, go easy on yourself, have lower expectations of like what you're supposed to do, how you're supposed to be. Remind yourself to show up and be of service, right? Like try to not think about what you need to say or trying to like, how can I make this better for them? Try to not think at all and just try to be of service. When you start feeling overwhelmed, maybe enough's enough. Or before you go, maybe get your cup filled up really, really high so you actually have something to give. Because if you don't have anything to give, it's going to be really hard not to be overwhelmed and possibly get irritated. So before you go, make sure your cup's filled up, however you do that. So then you have more to give because your cup is full. And then when you start feeling yourself getting overwhelmed and having too much, too much of whatever, you have to cut it off and get out of there. And then you can go back. So don't be too hard on yourself. You mentioned that a patient can sometimes control when they die, such as wait until a person arrives. Wouldn't that require a level of consciousness? Aren't they unconscious at that point? Pamela, lovely question. So, whenever I talk about the whole people like choosing when they're going to die, I would categorize that as a medical phenomena. So, I wouldn't categorize it as like someone being conscious and consciously choosing. This is something that is unexplainable. It doesn't happen all the time. Who knows if it's truly happening? Who knows if someone truly is choosing when or not? Like, we don't know that part, right? I, as a hospice worker, and many of my colleagues talk about it and educate about it because it does happen a lot. People will seem to hang on, especially if they're like bubbly and they're kind of like the matriarch of the family, or, it's their personality to kind of be the life of the party. They like people, they want people around. They could tend to hang on until everyone gets there. But if someone who's really private, shy, independent, prideful, shy, did I already say that? They might wait till everyone leaves the room. So it doesn't have to do with consciousness. It has to do with like being a medical phenomena that we can't explain. So, and it's like, we don't know why it's happening. And maybe there's a whole other biological reason that we haven't just figured out yet. Right. So, there is no explanation, and no, it doesn't have to deal with it doesn't have to deal with consciousness. And sometimes people are conscious enough to kind of like be in and out of consciousness, but not always. Could you explain what's going on with the trouble swallowing? Your videos have been invaluable to our family. Yes, for someone with Alzheimer's disease or dementia, they will eventually have trouble swallowing and then eventually likely not be able to swallow. And this is because the body stops being able to, like the brain stops being able to tell the body how to do it. It takes a lot of muscles and a lot of brain power, a lot of muscle power, and a lot of knowledge to unconsciously swallow. Our brain with Alzheimer's is forgetting all of the things that we did unconsciously: how to speak, how to pick up a spoon and put it to our mouths, how to go to the bathroom, how to feel that we're going to the bathroom, how to walk. It's going to forget how to do all of those things. Hence why it's horrific and hard, 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 hard. I don't mean to like make it sound, make you feel worse, but I want to validate how hard it is. So you're not going crazy if you think, how are people doing this? This is so hard. This is what everyone's thinking. It is so hard. That's why it's tragic and really, really hard. But that's why they're having trouble swallowing, because their body, first off, the muscles weaken. So their muscles here are weak. And then the brain is forgetting how to do it. The body's forgetting how to do it. So they're really high risk for aspiration pneumonia. So you never want to force feed a person with dementia or Alzheimer's. The number one thing that happens with people with advanced dementia or Alzheimer's: aspiration pneumonia, because people force feed them because they love them and they think they're doing good by them. And, or even if they don't force feed, sometimes the body just forgets how to do it. And then they silently aspirate some particles of that food, get in their lungs, it settles in their lungs and then causes pneumonia, aspiration pneumonia. And they end up in the hospital over and over and over again. So the best thing you can do, obviously consult with your doctor, talk to your doctor, and, offer food. If they want it, great. If they don't, let it be. And then you can always offer later. Because their body, they're not sitting there starving, wishing they could eat. Their body is already, one, forgetting, and two, shutting down that hunger and thirst mechanism. Hence why a lot of people with dementia and Alzheimer's, you'll see when you go to try to feed them, they'll shut their mouth. They will not open their mouth and they'll like tighten their jaw. So let their body be the guide. Let their body be the guide. Uncle Larry is still being a jerk. Mom's trying to help me by talking to me about it. How do I forgive someone like that who hurt my Aunt Susie? Laura, so this is the I am not an expert in things like this. So I think talking about it helps. And no one said you had to forgive anyone. Personally, I mean, only you know. Only you know. Now, personally, I think it's hard to hang on to resentments. Me being a recovering alcoholic, it's really hard for me to hang on to a resentment. So I want to forgive so I can be free. So that's my only advice. Forgiveness is for you, not necessarily for them. But I don't know the situation, and I'm not totally qualified to, like, really give an answer. I feel like a therapist would be more qualified, a social worker, but just speaking from my own experience, I try to forgive so I can be free. Welcome, everybody. Come on in. I'm Hospice Nurse Julie, in case you're new. I go live at 5 every Thursday at 5 p.m. Pacific Standard Time on YouTube. I am on all social media at Hospice Nurse Julie. If I haven't been answering your question, please feel free to keep asking, and eventually I hopefully will get to it, and try to ask it in all caps so I can see it. When my mom was dying, a hospice nurse told me to go home, and she died that night. I wasn't there. I felt guilty ever since, Carolyn. Yes, I hear this all the time. So curious, I wonder if your mom was someone who was very independent, kind of private, maybe prideful. Not prideful in a negative sense, but like pride herself on like how she dressed, how she looked. People like that tend to want to die alone. If she wasn't like that, that's okay too. I'm just curious. You know, um, it's hard. It's hard, but it's also important to take care of yourself. It's also important to take care of yourself. And I don't think, and this is just my own personal belief, so it doesn't totally matter, but I don't think anyone really dies alone. I kind of think our loved ones are already gone. Their essence, their presence, their soul, if you want to call it a soul. You don't have to, but I think they're already gone. I really do think it's just their body. Their body is slowly shutting down. This is the thing I want to talk about because it's important. So, 90-year-old stepmom had hip surgery, now CHF and pneumonia, chances of recovery. Tom, I would talk to her healthcare provider. So, if she is still in the hospital, I don't know, but if she is, talk to them. Everyone here, listen to me. Do not ask a nurse or doctor online things like this. We can answer things generally. I can generally talk about the end of life, but I cannot I cannot talk about something specific like this. And I don't mean I mean legally I actually cannot, but I also mean anyone online that is doing that is unethical, and don't listen to them because they don't know. A healthcare worker, and I'm not like lecturing you, Tom. I'm just using this as an example so people understand. I get why you're asking, but I want to explain why it'd be bad for someone to actually answer this. Anyone in healthcare would know they could not read that one little sentence and actually answer that. And if they did, don't listen to them because that's a bad healthcare worker. Does that make sense? Like I would have to know so much more. But generally speaking, what I would say is 90 years old, that means they are already at the end of life. No matter how no matter how healthy they are, right? They're already at the end of life. They're 90. Their end of life journey is starting, right? Even maybe she'll last to 100. That's still 10 years. I mean, that's a long time, but also out of the whole life, that's getting towards the end of her life, right? So, generally speaking, it's like I would take each day as it comes. If she's alert and awake and oriented and can tell you what she wants, then listen to what she wants and talk to her doctors. Talk to her doctors and let them know that you are open to, like what all's going on, and trying to understand like what her future holds. And again, I'm not mad that you asked that. I just want to make sure people understand. I just want to People do that all the time, so I want to make sure people understand. Sobriety looking good on you. Thank you. Okay. Let's see. Thank you to everyone who's being kind to Laura. We're glad you're here, Laura. Do you think pain meds interfere with paranormal experiences like visioning, etc.? You mentioned rates like 30% in some of your videos. Really, we think like more like 80% of people experience visioning, which is like insane, right? That's so many people. Um, do I think pain meds? I don't know if they interfere. I don't think pain meds are necessarily always needed. I would never be anti pain meds ever. Um, so do I think they interfere? I don't know. I don't know. I think so much of death is a mystery, specifically like the paranormal stuff, like the things that are like the medical phenomena. That stuff's a total mystery. A lot of end of life is a mystery because we can't study it much because look at the doggy, because there's no money in death. Isn't that sad? I just went to a conference and it's so hard to get studies approved for end of life stuff because there's no money in it. Like even if they were to even if they were to do the studies, people won't fund it because people know that even if we get these answers, it doesn't mean that they'll make money from that. And it's not the doctors, it's people investing in the things, right? Like they need to prove that like what if they get this answer, it'll either save money or make money. And they can't prove that. So they don't study much of it. So a lot of death and dying is a mystery. A lot of death and dying is mystery, but it's not always a mystery, but like things like medical phenomena that can be a mystery. And like do the meds make it happen or don't make it happen? It's really hard to know. Seclusion works. I think it's normal to not worry about going. That's amazing. Listen, if you're not worried about it, go with that. And someday if you are worried about it, that's normal too. Like I think it's really normal to worry about it. I'd say it's probably more normal to worry, but um but if you're not, that's okay. No, the nurse told me to go home. Hmm. Okay, Carolyn. I'm sorry. Well, you were just listening to that nurse. I hope it brings you some comfort knowing that actually there's not always things to say to bring comfort. I want to bring comfort and say, I do believe it was okay that you left. The nurse told you to leave. Probably felt like you had to go, and then she died. Um, I always and most humans want to like say something to like make everything better, but the truth is that like grief is hard. It's hard. And like you can't always say things to make things better. And I guess I'd more want to like validate that it's like a normal for you to rethink those things. And I don't think you should feel guilty over it. I truly don't. But it's normal to feel guilty over it. It's normal to feel guilty over it. She wouldn't want you to be beating yourself up over that. That's for sure. I know that. I don't even know your mom, and for sure she wouldn't want you to be beating yourself up. You know, she wouldn't. None of our loved ones who have died want us to suffer when they're gone because of them, you know? But it's hard. It's hard. Okay, let's see. I'm just looking through the questions. Thanks everybody who's saying thank you. I do see that. Patient with lung cancer spread all over, no pains or issues. Pain from radiation in one spot made him tired a bit. Signs to look out for. So, any signs to look out for that people are getting towards the end of life if they're on hospice? Hey, baby, is less eating and drinking, a lot less eating and drinking, a lot more sleeping, less eating and drinking, a lot more sleeping. Maybe increased. I'm just petting the dog. Maybe increased disorientation sometimes, decreased functional ability, meaning like harder to get out of bed. But the main thing you would see is more sleeping, less eating, more sleeping, less eating. That is the Roy baby. Hi, baby. I love you. How do you die from sepsis? You die from sepsis because sepsis is an infection in the blood, and having an infection in the blood is not good. And you usually have to get a bunch of antibiotics. But if you've already gotten a lot of antibiotics, your antibiotic it's antibiotic antibiotic resistant, which means they can't get a hold of the infection. And that infection basically infects your whole body. And then you can have multi organ failure and then you die. Hi, Julie. Can end stage kidney disease cause a change in skin color? Yes. Does this mean he has limited time to live? If is he this depends. There's a bunch of things that depend about this. So is he on dialysis? How bad are his kidneys? Is he still urinating? So I would say the skin color probably doesn't have much, it's not like that big of an indicator. But if someone has end stage kidney disease and they were on dialysis 3 days a week and then they stop dialysis, standard is someone they will have a very peaceful death, but it will be quick, 7 to 10 days. And the main symptoms you'll see is just like super, super lethargic. So sleeping 24 hours a day, confused, and itching. I hope that helps a bit. Does a pacemaker keep a person alive? No, pacemaker does not keep a person alive. Yeah, you don't need to turn it off at the end of life because it works with. Hey, Steph, I see you there. It works with the electricity in your heart already, so it's not going to keep anyone alive or do anything to like prolong life, and it'll just stop when the person dies. Thank you for everyone who's answering things in the chat. I appreciate you. What causes death in cirrhosis? The liver fails, and our liver does a lot of things for our body, a lot of detoxing. And when the liver can no longer do that, the person will die from a failed liver. You need your liver to survive, just like you need your heart to survive, or your lung to survive, or your kidneys to survive. You also need your liver. So if you have cirrhosis of the liver, you will eventually die because your liver will eventually fail and that will kill you. You'll start with the liver and then eventually all these bad things happen because it's not clearing toxins, right? And then eventually everything shuts down. So you eventually always go into multi-organ failure. But it's because due to the liver failing. You can't live without a liver that's functioning. We lost our mom 4 months ago. Before she passed, I asked her to send my sister and I signs that she was with us by hearing Tim McGraw songs on the radio. We never heard much of Tim McGraw on the radio. Aaron, I'm so sorry. You know, that kind of stuff has happened to my mom too. My mom, her brother drowned. Her very favorite brother drowned when she was 19, and she is now 70 something. And she says that she's really never gotten any signs from him, any feelings that he was around, nothing for decades. And it's like really crushed her that she hasn't felt that. So I'm really sorry that you're experiencing that. And I'm curious to see as time goes on if that changes, you know. But it's hard. Losing someone is hard. Hi, Julie. I'm suffering from depression and anxiety. How would you handle a patient with depression and anxiety? They could, one, if you had depression and anxiety like lifelong, we have many people who die with mental illnesses, schizophrenia, bipolar, depression, anxiety. And they could continue to see their psychiatrist if they really love their psychiatrist. So they could keep seeing them and managing it that way. We'd also take that into account and make sure that we give you the right medications. We have a social work, we have a chaplain. So we try to treat you as like a whole person. And you wouldn't have to stop seeing your therapist if you had one. You wouldn't have to stop seeing your psychiatrist if you had one. So we would just treat that along with your terminal illness. Everyone is saying they're getting ads. Oh my gosh, I'm so sorry. Hi, Julie. Question. If someone is refusing oxygen, do you see the person go quickly? My mom has COPD, incontinence, now asking for pain meds, which I refuse. Used to smoke, drink weeks ago. Yeah, I mean, I don't know, is she on hospice? So I could only speak to someone on hospice. If someone on hospice with COPD is refusing oxygen, they may die sooner. Yeah, because they may die less comfortable too, but morphine's a great drug to give someone who has COPD. I would not refuse her pain medicine. Pain medicine is great for shortness of breath. I also wouldn't refuse her smoking or drinking if that's what she wanted. That's just me as a hospice nurse. I know it's a little difficult when you're the daughter, and I don't even know if she's on hospice. But if someone's on hospice with COPD and they're refusing oxygen, that's okay. If they want to continue to drink and smoke, that's okay. And yes, we would give them morphine for shortness of breath because morphine relaxes the central nervous system, which gives you the overall feeling of like, so I would definitely recommend you talking to a doctor or your hospice team. Would you consider doing interviews or hearing stories of family members' perspective on having a loved one pass on hospice? Yeah, I thought about it. That would probably be something more like a podcast if I did something like that or like a call-in show. But I just haven't had the time or like the willingness to like put in more work to do something like that. If hospice delayed sending an order to an assisted living for additional morphine and liquid Tylenol for 2 days, considered negligence. They had yes, that's definitely negligence, Carol. I would be throwing a fit. Yes. Now, do I think they did it purposely? No, I don't think they purposely did it. But that's why it's hard. It's hard sometimes because you kind of have to be the person like pushing, 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 pushing because it's still healthcare. We're still humans. We're still overworked and making mistakes. So I don't think anyone purposely did it, obviously. But it sucks that sometimes we have to be the one kind of really pushing, 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 pushing. And sometimes working with a hospice and then working with a skilled nursing facility, there's like it's like crossing wires. It could be really hard too. Oh, Julie, I'm sorry. I meant we've never heard so much Tim McGraw on the radio. Aaron, oh my God, makes me still feel so much better for you. Oh, that makes me feel so happy for you. That's so wonderful. That's so wonderful. I'm glad I saw that, Aaron. Welcome everybody on TikTok too. I'm not going to answer questions on TikTok. I am on YouTube, same name, Hospice Nurse Julie. You can come join the line over there. You can listen on TikTok if you don't feel like leaving. You can just listen to it over here. Thanks, guys. Hello, my mom currently has end stage liver disease and she will miss dialysis 2 out of the week. She just got home today from the hospital, but all she wants to do is sleep all day. Charisse, I think that's how I'm probably saying your name wrong. Um, or Shanice, maybe. Yes, you can't really miss dialysis. Now, she's not already on hospice. I can't really speak to that much, but people who have end stage renal disease, and if they start missing the dialysis, they will start having a lot of issues, which will take them in and out of the hospital. So I think you need to start talking to her about what she wants. What she wants. Does she want to continue dialysis? Can her body actually do it? Right? Maybe start talking to her dialysis doctors if you know who they are and say, are we getting to the point we need to stop dialysis? Like, when is enough enough? Because eventually the body cannot handle dialysis. Now, I have no idea where your mom is at. So please take this generally. Like, I have no idea. All I know is if anyone truly is at the end of they truly can't, their body like can't tolerate dialysis anymore, or they say, I don't want to do this anymore. End stage kidney disease, once you stop dialysis, is very gentle and it's very gentle and it's very peaceful. It's like a peaceful, gentle death, but it does happen quite quickly. So you usually stop dialysis. If they're not making urine, they usually will peacefully die in 7 to 10 days on hospice, with very few symptoms. Maybe a little confusion, mostly sleeping, no eating or drinking, very normal, and it's very peaceful. But it's too hard to know. I would have to, you should talk to her doctors. And if she continues dialysis and continues to tolerate it, you know, it's a whole nother story. Oh, thank you. Thank you, our motorcycle adventures. Julie, do people donate their organs who are on hospice? How is that handled? Um, or do they need to be in the hospital? I agree. Sobriety looks terrific on you. Thank you. Carrie, so people can donate their whole body. If they're on hospice, they can donate their whole body to science, technically, to like a medical school. They can sometimes donate their eyes. They can sometimes donate their brain if they're in a special, like Alzheimer's thing. I just saw a new thing for people with autism too. They can donate their brain, but you can't donate your organs like your liver to someone who needs a liver. That can never happen with anyone on hospice because their organs aren't really working. So they've had a long period of time where their organs weren't really working or functioning, so they wouldn't be able to like salvage the organs. In order to salvage organs, the person has to be basically kept alive, their organs taken, and then allow them to die. But you can donate the whole thing. How can I get my mom into hospice if she refuses everything? Our hospice companies are really, really good about this. So you can try to get the doctor to refer, and then you can work with the hospice company to see how it goes. But it can be difficult. I get it. But hospice companies are good at that. Thank you to everyone who's saying they love my book. Does a hospice patient go through withdrawal from their medications? I don't know why they would have to if we don't stop them. Not all medications make you go through withdrawals first and foremost, but we wouldn't stop them anyway. Do you comfort someone with Alzheimer's who has persistent fear? She's in memory care. How do you comfort someone? It's very, very hard with Alzheimer's. It's very, 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 very hard. I would talk to people at the memory care facility because they do have like experts there, people who are like really, really trained on how to deal with someone with Alzheimer's disease. But many times it's through medication and it's not fun. It's not easy. It is not fun and it's not easy. They don't have direct answers all the time. It's very, very difficult. But sometimes it can be through distraction. Sometimes they can find something to hyper focus on. Sometimes there are things that they can do to help just alleviate some of that anxiety, some of that agitation and fear. But sometimes they just need to be medicated, which is really sad, but have seen that where it's like people are either like asleep and comfortable or awake and not okay. So it just depends. But sometimes people can get there, just take some hoops to jump through and like medications to try, then to increase it and then increase it some more. And then eventually you get to a baseline where they're just a little more comfortable. Oh, thank you, Julie. Thank you, thank you, thank you. Hey, Julie, can you explain hospice centers? So, I don't work in a hospice center, nor have I ever been near a hospice center, but there are states that have like hospice centers, meaning like a whole hospice, like home, a hospice facility where people, instead of having hospice in their home, they go to hospice in a hospice center. I'm not that familiar with them because they don't really have them in Southern California, at least in Los Angeles. But I think they're a great idea. I think they're a great idea. Now, the people don't get to be home, but their families don't have to do all of the care for them. What's the worst disease to die from? I mean, it really does depend. Personality plays a lot. So, planning for your own death, trying to get acceptance around death, trying to be able to like accept help at the end of life will help. So anyone who can start adjusting and like be able to deal with change, like think about your personality now. If you're like rigid and neurotic and anxious and scared and like reactive now, you will be like that at the end of life. And if you don't want to be like that at the end of life, you need to work on that now. Okay? So if you're listening to this and you're like, "Oh shit, that sounds like me." You need to go to therapy. You need to start meditating. You need to start doing something to take care of yourself because that will play a lot into how it goes down. Okay. And then there are diseases that are harder than others. Glioblastomas are hard because people are usually young when they get them and it involves the brain. So it's hard. ALS is hard. Alzheimer's and dementia, they're hard. Now, the deaths are not that hard, but the time before the death, which is usually 10, 15 years, can be hard. So it does depend, but there are like diseases that are harder. Anything involving like the liver can be hard sometimes. The bone can cause pain, but a lot of times we can get pain under control. Sometimes like ovarian cancer can be hard. Depends if you have like tumors places. So there's a lot of things that it depends on. It depends. But if someone's anxious about the end of life, I would normalize that. Make sure you normalize the fact that it is very normal to be anxious about end of life. If you have death anxiety, super normal. I have heard through people who've had death anxiety and a lot of anxiety about end of life. I've heard from them that like reading my book, watching my videos, learning about things, listening to my videos, Hospice Nurse Penny's videos have helped them decrease that anxiety. So that's one way. Just normalizing it and knowing that the fact that you're even willing to talk about it really, really will help you, even though it might not feel like it right now. It really, really will. And then, two, I do think generalized anxiety, like whether it's about death or about a plane ride or about whatever, yours just happens to be about death. So, some people truly do have like health anxiety, right? Or like a panic disorder around death. I don't think it's really around, I don't think death is a real thing. I think it's like a panic disorder. So I also think medication and therapy can really, really help if it's something like that, like really, really embedded in you, like having OCD thoughts about life and death or about your health, that kind of stuff. I do think would people should probably get medication and therapy. Now, I'm not this is just me talking. I'm not a therapist or a psychiatrist, so I have no idea. But yeah, that's a very long-winded answer to that. Can you comment on how long people can live without nutrition, specifically if they have extra body fat, BMI? Um, no matter how big you are, like if you truly have no food and water, truly no food and then no water, I mean, I'd say like maybe the longest would be 3 weeks. Now, if they were drinking water the whole time and had no nutrition, maybe a little longer, maybe a couple months, but that's just sort of eyeballing it. But you really do need to eat and drink, right? So, and if you are not dying, like if you're not actively dying and like you just happen to be like on a hike and you got lost and now you're stuck somewhere with no food and water, that would be a painful death. So, dying of starvation and dehydration when you're healthy is hard, is hard. So, don't get it twisted. Okay. So, the only time it's not like that is when you're already dying because the body has built in mechanisms to kind of help you not feel hungry or thirsty purposely because it knows it's shutting down. Um, Sherry C, I cannot answer that question. I'm sorry. I do not know. And I don't have enough information to fully know everything. So some questions I can't answer. It would be really like unethical of me to try to answer a question that you'd have to have so much more information. So talk to their doctors, talk to the doctors, talk to the doctors. Some things are too broad. There's too many things you'd have to know to really answer something like that. Have you ever had someone choose not to get chemo and go right on hospice? Yes. Yes. My mom is currently end of life care for bone cancer. She is not conscious. Can she hear me? We do think people can hear you. So please talk to them like they can. Yes. Now, like, I don't know if it's necessarily like they perfectly hear us, but they just can't respond. It's not like that. We've been told from people who have been in comas who come out of comas that they could sense and feel people and hear people, and it was really comforting. So we always say, we do know the is the last sense to go, so just continue to talk to them like they can respond, but they're not. Yes, Shauna, you are not. People at the end of life will not eat and drink. They physically can't, but our bodies do shut down that hunger and thirst mechanism, so they do not suffer. They do not suffer. In fact, it actually probably feels better for them to not eat and drink. Question: is there any advice you have to give someone who's going through school to become a hospice nurse? Yes, just keep on going. Put that head down, do your work, C's get degrees, and make sure you study for the NCLEX, and you'll learn everything at your first job. So don't stress too much about nursing school. I know it's really hard not to because they stress you out there, but as long as you get your work done, pass your tests, you'll be okay. Then study hard for the NCLEX. And once you pass that, you'll learn everything you need to know on the job. For how to talk to kids about death, I would go on Instagram. I wish I could think of their names right now. There are so many good people on Instagram talking about how to talk to kids about death. Type in like the search bar on Instagram, like how to talk to kids about death, and like so many good accounts will come up. Or you can just Google it because I actually don't really know. I don't do a bunch of kid stuff. Um, Someone feels guilty. Their dad said they wanted water and the nurse wouldn't let me give him it. Oh, I'm sorry. Were you allowed to give them like a little wet sponge or anything? That's what I always suggest. When they really can't have water, I always suggest like a little wet sponge. Sorry, Virginia, that's so hard. Liver failure coupled with kidney failure, good or bad? My wife is dying now on home care. If she is on hospice, I would go by how she looks, Soul Trader. So it's not good or bad, it's like, how does she look? Does she say she's okay? Does she look comfortable? Is she clean? Is she safe? Is she comfortable? If all of those things look okay, then they are okay. Then she is okay. She hasn't had like that much of a hard time yet, then she might not. So it just depends. Liver failure can be difficult. They can have ascites, they can have shortness of breath, they can have some pain. But if that hasn't been happening with her, it might be okay. And sometimes the kidney failure will be like the thing that takes someone faster, meaning they die faster because of the kidney failure. So they don't have all of the liver stuff come up yet, which is kind of a good thing because that's where they can get a lot of symptoms. So it just depends. I would go by how she is now. If she's already on home hospice and you think she seems pretty much comfortable, then all good. Take it a day at a time. And if not, then I would talk to her hospice team to say, hey, how can we get her more comfortable? My mom is 83. Her health issues are managed. I noticed recently her skin getting quite pale, no modeling, just very pale. Is that normal? Yes, Eva. And I totally wouldn't worry about it if I'm honest. I mean, you could always talk to her doctor, but that's not really like that happens to like anyone who is is just getting older. Why are they not allowed water? So people are allowed water at the end of life. Sometimes people will have a stroke and they actually physically cannot swallow. If they cannot swallow, this is where nurses need to start educating people a little more. They'll just say, no, they can't have water, but they should really educate. So technically, if they can't swallow, then we can't give them water because they'll swallow it into their lungs. But other than that, people can have water specifically if they're asking for it. So he must have had some kind of thing where he could not really swallow. Now, in that case, I probably would still have them like moisten the mouth and stuff the best they can. But it can be hard because you don't want them to aspirate or choke on water because that could be hard too. Have you ever grieved a patient's death? Yes, I have, but I mostly feel okay about people dying on hospice because I feel like Everyone's gonna die, and if you can die on hospice and have it be a peaceful death, um, um, I think it's better than other deaths, I suppose. Oh, Soul Trader, I hope I answered your question. I thought I did. I'm sorry, I keep missing it. A lot of questions tonight, you guys. Like, I'm not used to like so many questions. This is really great, but I'm sure I'm missing a lot. So thank you for being patient with me. How long can terminal agitation last? It can last as long as they are alive sometimes. Like sometimes terminal agitation can be um now I don't want to paint a picture of like it being like horrendous, but just so you know, it can last until they die. Until they die. So hence why some people we need to keep them heavily medicated because they're either heavily medicated and peaceful or awake and not peaceful. So it just depends. It depends. But sometimes we have to, someone has so much agitation that we have to keep them like sedated until they die, even with a water thickener. Yes, Kitty Cole. So some people cannot swallow water even with thickener. These muscles here are no longer working because no, not always, but sometimes at the very, very end of life, or if someone's had a stroke, these muscles will not work. So if you swallow water, even with thickener, it will go into the lungs. Have you ever been to a hospice patient's funeral? I haven't. I haven't. I do regret a couple funerals I didn't go to. I do regret, but now I wasn't asked, but I would have liked to gone to a couple patients' funerals. So I kind of regret it, but I also really have good boundaries. I really hold really good boundaries with my work and families. Do most patients cry out family members' names at the last moment? No. Thank you for everyone that's helping me answer some of the questions in the chat. I really appreciate it. What is it like for women going through ovarian cancer and hospice? It varies. So it can be difficult, but it does vary. It depends on where it metastasizes to. It depends on if there's tumors or not tumors. It depends on if something's blocked or not blocked. I've seen a lot of difficult ones because they've had tumors that were blocking like part of the colon, so they couldn't go to the bathroom and then they were vomiting. So there was a lot of issues. And then sometimes it's not like that. So it depends. So it can be hard, it can be difficult, and sometimes not that much. So it just depends. I know, Eva. I noticed that too. My dad's dying right now. Mandy, I'm glad you're here. She must be in the UK because she talks about a syringe driver, maybe Ireland. Is the syringe driver what he needs? He said twice today he wants to leave Earth. Mandy, I'm so sorry. I am not familiar with the syringe driver, one, and two, I'm not there, so it's hard to know. I don't know if you have people readily available that you can talk to, but that's what I would try to do. Talk to someone that is caring for him. Like I don't know if he's on palliative or hospice or what he's doing, but I would ask one of them. Would you go to a patient's funeral if they were to ask specifically? It depends. It depends. Probably, but it still depends. My twin sister's a hospice nurse went to her funeral. Oh, yes. I think it means a lot. That being said, yes, like if someone asked me, I think I would, but there's always some reason sometimes not to, or sometimes you can't if you're working or whatever. But um I'm just reading through some stuff here. Sorry. Why do patients experience increased sensitivity to touch at the end of life? My dad could not stand the feel of drops of water shortly before he passed. Leslie, everyone's different. Not everyone experiences that. Sometimes people have like a reverse thing where they're like, instead of, yeah, no, it just depends. It just depends. I wouldn't say that's like, I'm not saying that's wrong or bad, but I wouldn't say that's necessarily normal. It's not like, oh, everyone who's dying gets extra sensitive skin. Ooh, Angela, I'm a traveling caregiver and wanting to get more into hospice care. Do you have any advice for me to take the steps for me to get started on what I need to be? I don't know. I think maybe you could just you could maybe get your CNA. Are you a CNA and just work for a hospice company? You could try to find like personal clients where they pay you just like like your own business, like you're a contractor. I will say I am going to have a class coming up to teach people more about like and to teach caregivers or family members anything they need and want to know about hospice. I am doing that. Do you ever feel worried going into a patient's home? I'm in nursing school right now and I'm really interested in hospice, but that is my own hesitation just being alone. Yes, definitely feel weird sometimes. Yes. Yes. I've had a couple times where I have felt like that instant panic for a second and then it went away cuz like I walked into a house and it was like pitch black and it freaked me out. But I will say, it would be hard as a new nurse. That's why I don't ever wanna say people shouldn't go into hospice as a new nurse. It would totally be fine. But if you went into hospice as a new nurse, I would definitely make sure you didn't go into home hospice first. You should go into like a hospice care center where like you're with doctors and nurses all the time to like learn everything you need to learn. Also, you need to be really comfortable. Like it took me a long time to be comfortable like setting boundaries as a new nurse, I didn't know how to do that. But now if I ever felt uncomfortable in a home, I would leave, no questions asked. I probably wouldn't even tell people. Like, if I was feeling that uncomfortable, I'm out of there. Like, I'm not staying. So, you have to be comfortable to be able to do that. You don't have to explain yourself. If you are not comfortable, if you feel unsafe, you get out of there. End of story, period. End of story, period. Okay, you guys, it's 6 o'clock. I got to go. But I love you. I'll see you next Thursday. I'll see you next Thursday. Start looking out for my next video. And I do have some new things coming down the pipeline that I'll keep you updated with. And if you want to like know all the things, go to hospicenursejulie.com and sign up for my newsletter. I will not oversend anything. I swear. I don't like writing newsletters as much as you don't like getting them. so, so if you get a newsletter, it's only because new things are coming out and there's like a special deal or whatever. So if you want that, go to hospicenursejulie.com and just sign up for my newsletter. Mwah. Thank you for all your support. You guys are the best. You guys are the best. Love you. Happy Valentine's Day. Same.